Hi, I'm Sandra. I'm one of the triage nurses in the emergency department. Can you tell me why you've come into ED today?
Sure. I've got a cut on my big toe. I've also got diabetes and I'm worried the cut's going to get infected and cause diabetic complications.
Oh, I'm sorry to hear that happened. I need to ask you some questions to get a better picture of the injury, if that's okay?
Yes. That's okay.
Can you tell me when and how it happened?
It happened 2 days ago when I was walking on the beach. I wasn't wearing shoes and cut my big toe on some broken shells.
Okay. Can you tell me a bit more about the cut itself? For instance, whether it's shallow or deep and the amount of bleeding after the injury.
I think the cut's quite shallow. There was some bleeding at first, but I was able to stop it by putting pressure on my toe.
Great. So you put pressure on your toe to stop the bleeding. Did you do anything else like flushing the cut with water, for example? And trying to remove any sand or dirt? And possibly covering it with a clean cloth or dressing?
Yes, I did all those things. I poured tap water over the cut for about 10 minutes. I tried to get out any pieces of shell that I could, but I'm not sure I got all of them out. I covered the cut with a clean cloth. But as I said before, I'm worried about getting an infection, so I came to ED to get some antibiotics to prevent that from happening.
I can appreciate why you're concerned about an infection developing, but you did the right thing coming to hospital for treatment and giving me your diabetes diagnosis. Before deciding on appropriate treatment, the doctor will need to examine you and do a complete wound assessment. One of the nurses will clean the cut and redress it, and give you some advice about wound care at home.
Okay. I understand now that I need to see the doctor first and have the dressing done afterwards.
Great. I'll explain what will happen now. I need to take your clinical observations first. Then I'll ask you to go back to the waiting area until the doctor's ready to see you. As I mentioned before, the doctor will examine you and assess your cut for signs of infection. Then you'll be prescribed appropriate treatment. After that, one of the nurses will do the dressing. Are you ready for me to take your clinical observations now? Yes. I'm ready for you to take my clinical observations.